There's so much misinformation on this, on HRT, and even amongst my friends, they don't know what to do because there is a general belief it's bad for you. You shouldn't do it. And then there are other women who say, well, I don't have hot flashes, et cetera, so I'm not going to do it. And what I glean from your panel and your book for that matter is there are other reasons. It's not going to cause breast cancer and in these numbers that we were told in 2002. It's a very, very minimal risk. And secondly, it's got a lot of really good benefits.
Women have been confused for good reason. The medical establishment they're not even all on the same page. And the misunderstanding around the studies has created a lot of dogma that you should not take hormone replacement therapy because of an increased risk of dying of breast cancer. Now, it turns out when you look under the hood, no clinical trial has ever shown that hormone replacement therapy for perimenopausal women increases the likelihood of dying of breast cancer. Now, there are importantly two different areas of benefit, and I should just point out there are contraindications. Some women cannot take hormone replacement therapy, but the vast majority of women going through perimenopause can have not only short-term benefits, but long-term health benefits. And often when people talk about how it alleviates hot flashes and night sweats and helps with mood swings and better sleep quality and helps prevent some of the weight gain associated with perimenopause. They're really only talking about the short-term benefits. Now, I'm not here to say they're more important or less important than the long-term health benefits. I'm not a woman. But look at the studies on the long-term health benefits, cutting the risk of heart attacks in half in some studies, or 25 to 50% reduction in other studies. That's the number one cause of death in women. And it may prevent Alzheimer's, reduces the risk of cognitive decline by up to 64%, reduces osteoporosis risk and the risk of bone fractures, cutting that risk in half. Those are some of the serious long-term risks that can take the life of an older woman, is risks of bone fractures and hip fractures. So there may be no other medication in the history of modern medicine that can improve the health outcomes of women on a population level than hormone replacement therapy when started within 10 years from the onset of perimenopause. The incredible health benefits of hormone replacement therapy described by the experts at the FDA expert panel just recently have been in the bucket of things in modern medicine that have been underappreciated, underrecognized, and underfunded, probably because it deals with women's health, and that it is something that needs to come to the surface.